Hi everyone, Felix here, Advanced Clinical Practitioner with Eden Clinic. This is the next instalment in a mini-series of videos on HCG and its use in TRT. So we've covered what it is and how it's made and briefly looked at its safety profile. We very briefly touched on its makeup and mentioned alpha and beta subunits. In this short video, we're going to go and expand a bit upon that in order to gain more understanding about how HCG can be used as an adjuvant to testosterone replacement therapy. So, HCG is comprised of an alpha and beta subunit. Luteinizing hormone and HCG share an identical alpha subunit, though the beta subunits do differ. Interestingly, there is some evidence that it can potentially attach to the follicle-stimulating hormone receptor as well. Under normal or eugonadal conditions, the hypothalamus of your brain will secrete gonadotropin-releasing hormone, or GnRH. GnRH then stimulates the anterior portion of the pituitary gland in the brain to produce LH and FSH, which can then stimulate the Leydig cells of the testicles via the LH and FSH receptors to ultimately produce estrogen and testosterone. They of course play a large role in spermatogenesis too. Testosterone and estradiol are then detected at the pituitary gland and hypothalamus in a negative feedback loop, which in turn causes a reduction in the output of GnRH and LH and FSH. FSH primarily stimulates the Sertoli cells of the testes, which produce inhibin and inhibit the pituitary gland from producing more FSH. Please do have a watch of my video on the HPG axis just up here by clicking that link for a better understanding of the negative feedback system I just described. So, if HCG has a similar molecular structure to LH, is it detectable as LH in the blood tests we do? No. Whilst it shares an identical alpha subunit, it does differentiate in its structure therein, so it will not be detected as LH in the blood test that you have. Your LH and FSH will always be suppressed when on TRT. So what about its pharmacokinetic profile? Well, the mean half-life of HCG is approximately 36 hours to 2.3 days, depending on which sources you look at, meaning you'll likely feel its benefits, if you're going to have them, within approximately 10 days after commencing treatment with it. If you enjoyed the video, please hit the like and subscribe button and make sure you hit the bell notification to catch the next video in this mini-series. I'll see you in the next one.